Okay, my daughter was diagnosed with sleep apnea at the age of 8 years old. It took us about 9 years to meet Dr. Chesedi, and so far it's been great. The diagnosis was different than the one they gave us, and we're so happy with him that he's a great doctor. Um, there's a lot of things I could say about him, but with my daughter, he's been very, very well. We were struggling with doctors, different diagnostics and things like that, and she was not feeling well. Matter of fact, she was using the wrong equipment when we met him, and he was the one that diagnosed the right equipment. And so far, it's been slowly, but progressively, she's been doing well. And to this day, he's been the doctor, and she lost weight. She is breathing a little better. She's doing a little bit more exercise than before. She was not able to do that.
And I would like to add that I think the key to Dr. Shahidi being, Dr. Shahidi, is that he listens to the patients.
We're very happy with the staff here. The facility is well kept. The equipment is the latest technology, and every time we walk in here, we've been treated as a family, and that's what I like the most. We've never been treated as a patient or anything like that, or a number. It's always been like a family relationship.
Yes, the best part about this place is that it's basically home. You're never gonna feel left out or anything. It's just a nice family-oriented place. So.
Shelly Holguin is a very interesting patient, very rare condition of Rohat syndrome, that is rapid onset of obesity with hypothalamic dysfunction, that during which she has, in these patients with Rohat syndrome, they have central hypoventilation syndrome. And interestingly, the very first time I met her was years back. I don't remember exactly when was that, but she was admitted to ICU with a very severe apnea, and she was not able they were not able to wean her off the ventilator. And I saw her when eventually we put her on BiPAP and adaptive servo ventilation. We were able to wean her off the ventilator, and then I kept seeing her in my office, and she's currently on adaptive servo ventilation, and that is the only modalities that of treatment of the positive airway pressure that she could tolerate. And then not during the night. The problem with the central hyperventilation syndrome is during the night when she goes to a deep sleep, her brain is not signaling her lung to inflate and deflate, and that is a kind of what in the past they would call it as an undying curse. And so she cannot really sleep without any apnea if she's not using the adaptive servo. And the adaptive servo is a very interesting way of ventilating her. And as soon as she cannot breathe or breathing very shallow, then the machine is breathing for her. So that is the only way that now it helps her. So she had a very morbid obesity actually, and she had all the other metabolic problems like diabetes, as well as like a high blood pressure, and we managed everything, and she's now able to walk without oxygen, and she's back to her kind of normal life. She's not 100% normal in terms of like activities, but she can actually take care of herself. And she's another success story that since I saw her and I started her on the new machine, she's very happy, and this is another success story.
I would just say he's an amazing person. He's always there for you no matter what, and as a doctor and as a person, he's just amazing.
I want to give this opportunity to say thank you to Dr. Chesedi. He's been an amazing person, and also we can call him anytime and at any time of the day, and he's always available. We never had any problems with him, and he treats my daughter like he's his own daughter, to be honest. I mean, I can't say anything else more. He's a great person, a great guy.